Hello, everyone. Today we're with Melissa Noyes from Family Health Centers. And Melissa, if you could just start off with an introduction and tell us who you are, a little bit about your background and what you do at Family Health Centers.
Absolutely. I'm delighted to be here today. My name is Melissa Noyes. I am Communications and Planning Coordinator for here at Family Health Centers. I have a background in public health, a master's in public health from George Washington University in Washington, D.C. And I've been working with community health centers for 10 years, for a long time. I really kind of got started in the marketing aspect of community health centers and nonprofits by accident. Marketing and communications sometimes tends to be an afterthought, mostly because of resources. So I saw a need in one of the first organizations I was working for, just kind of maintaining our presence on the internet, websites, how we were communicating with our members and the people we worked with. And I just kind of built my skills on communications and marketing through that initial kind of needing to fill a role, needing to fill a gap in services. And with that, with Family Health Centers, kind of had the unique opportunity of bringing both my public health career and my learned skills in communications and marketing. I've only been here about 6 months, but it's been a very interesting 6 months working. I've gotten the opportunity to work with the New York Times on a front page newspaper article that features Family Health Centers and our work that we're doing in terms of the changes that we're going through under the Affordable Care Act, our patient-centered medical home transformation, and our implementing our electronic health record system. It's a lot of different work going on. I do a lot of work trying to inform our patients and the community that we serve about both our services and the opportunities under the Affordable Care Act or Obamacare, opportunities to become covered under the Medicaid expansion or through purchasing qualified health plans. And then also in reach with our own staff, trying to get them on board just with understanding why we're doing the things that we're doing, how to communicate effectively with our patients when they have questions, and also just to have them understand why we're doing the things that we're doing, why it's important, understanding our goals and objectives, because we ask a lot of our staff, so communicating internally is probably just as important on my list of things to do as communicating with our patients.
Melissa, the Affordable Care Act has required family health centers and other healthcare facilities to really think strategically and plan for that huge change. What kind of planning and strategic thinking have been going on within family health centers?
So foremost, just meeting with other local organizations. The Affordable Care Act is a national initiative, but everyone kind of has their own little part to play. So right now, in terms of strategically planning, working with the local health department, with the other community health centers to understand what they're doing in terms of outreach and communicating, so that we're on board with the same messaging, that we're not kind of muddying the waters with different information. So just really right now we're at the point where we're trying to come together and say, well, what do you want to say? What do you want to say? What do we all want to say that's effective to the uninsured population? Because that's really who the information, the Affordable Care Act right now is kind of coming to a head. Open enrollment through Medicaid expansion or through the Health Benefit Exchange begins October 1st. So we're really on a timeline to raise people's awareness about what the opportunities are. So just kind of coordinating what our message is, how we're going to get that message out is a big part of what we're trying to do. And then also understanding our own population. We have 22,000 uninsured patients, the majority of which are going to be qualified for Medicaid expansion, and most of whom don't really know what this means for them or how they're going to do it, or they have negative connotations about Obamacare. So really trying to get out a positive message that this is something that's going to help you, and then what we're going to have on what we have available to help them. We're going to have in-person assisters at all of our health center sites, so that they're not alone in this, and that they don't have to navigate this kind of new system by themselves. So coordinating a community-wide message that doesn't just stop with Louisville. What is the state doing? Connect, the Health Benefit Exchange, Kentucky Voices for Health, kind of bringing in all the players to really kind of have a universal message. It's a huge endeavor, and it feels like we're really kind of moving fast forward right now. So back-to-back meetings, and just kind of being on board with whatever we can do.
How would you say that marketing differs in the nonprofit sector versus the for-profit sector?
Well, marketing, I kind of see for ourselves is really about, I don't want to say brand management, but that's the kind of technical term. It's really about what is your reputation and managing your reputation, and that kind of comes down to, understanding, what people are saying about you. I think one of our biggest ways that we market ourselves is just through word of mouth, through grassroots. People know about Family Health Centers or the Portland Clinic or Phoenix just from people telling each other about their experiences here, or you need a doctor, you can come to Family Health Centers and we'll be able to care for you regardless of your ability to pay. So making sure that we have a positive patient experience, so that when they go out and tell their friends and neighbors about Family Health Centers, it's a positive message. I think that's something that corporate people probably don't need to think about, because they have a lot of money at their disposal. We don't spend a lot of money on marketing. We do bits and pieces of advertising and the local circulars, but you're never going to probably see Family Health Centers on the billboards on I-65 or 64 or anything like that, because that's just not where we want to spend our money or our time or focus. We'll spend more time in terms of what are we going to tell our patients in the lobbies, or what do we want their experience to be, so that what they tell their neighbors is positive about us. So honing the message for us is really important. If you were to walk away, what is the one thing that you would want people to know about Family Health Centers? And that's really simply our mission statement, that we're here to provide quality health care services regardless of your ability to pay for those services. And then kind of building upon that with our vision statement. We want to provide the kind of care for you and your families as the same kind of care that we would want for ourselves and families. So I think just kind of building on that customer experience to have that grassroots impact is where we would focus our time and attention for marketing.
Melissa, you mentioned the New York Times article. Are there what are some other specific ways that Family Health Centers is marketing itself, or plans to market itself in the future?
So like I said, we also do, with the New York Times article was kind of a very unique opportunity, and that's marketing on a kind of national scale, and that's kind of marketing to a different kind of audience than our customers. Our customers are patients in the communities that we serve, the underserved communities. The New York Times targets a much different audience, and so when I think of kind of the national, where that information is going, I'm also thinking about, wow, we could potentially leverage that marketing with fundraising opportunities, because that's hitting a very different market than when we do things locally and internally. Some of the local advertising and outreach that we do is we put advertisements in the Portland Anchor and the Louisville Defender, two local circulars that kind of hit different populations and neighborhoods that we serve. So it's affordable to us, and these are free circulars, so they're accessible to everyone. Internally, we do a little, we call them lobby letters. They're for our patients. We make sure that it's in English and it's in Spanish, and it's written at a level that all of our patients would be able to understand, typically the 5th or 6th grade level, and that's just health literacy kind of guidelines that we follow. We have a health accent TVs in all of our health centers, so we put up targeted messaging. Right now we're focusing heavily on our outreach and enrollment activities for Medicaid expansion and the Connect, so we have those kinds of messages directed to them. And then just also informing our staff about different information so that when people have questions that they can kind of be on that front lines to understand that. And we do that through, I go and I talk to our different department meetings. I do a staff e-newsletter so that people can be informed. I write things for our executive director so it can go out to from him. People will probably be more likely to read things that have, you know, the boss's name under it versus Melissa Noyce. So just kind of making sure that people are informed on multiple levels, internally and externally.
Kind of final question. The folks that are watching this video are students in my class who are getting their master's degree in business communication with a concentration in nonprofits. So these folks many of them are currently working in the nonprofit field or want to be nonprofit managers in the future. Do you have any words of advice or wisdom for folks going into nonprofit work?
Be passionate about your mission. Be willing to kind of do the work that needs to be done, not necessarily if it's kind of just falls under your title or your purview, because you'll gain a lot of experience in terms of just kind of filling in the gaps, and that will become a valuable, people will see you as valuable in doing that. I always kind of have the mentality of going into a new workplace that I'm going to be seen as indispensable within that first 6 months that I'm here, because I'm going to be able to fill in and just do the work that's needed regardless of if it kind of is beneath me or under my job title or what have you. So I think just being very flexible in your work attitude, being very passionate about what you do, I think that resonates. People can see that when they talk with you or they work with you, that you really believe in what you do. I think those are my two kind of words of wisdom. Just, you know, do the hard work, do the Lord's work, as I like to say, and do it with passion.
Great. Anything else you want to say?
Good luck. Good luck.
Thanks a lot, Melissa.
Thank
Appreciate
you.
it.